when these animals are born, what should we do to sort of make sure that they're doing okay? And then now that they are new members of the herd, what should we do to make sure that they are, from a health standpoint, responsible new members of the herd? So the neonate should stand and nurse within the first 2 to 4 hours, and one that's really normal is going to be up in 30 minutes like most of our other herbivore species, and is going to be up aggressively nursing in about 30 minutes. And so if it's been 2 to 4 hours, while that is probably not grossly abnormal, I'm going to keep an extra close eye on that guy, because he really should have been showing much more signs of aggression during that first hour or so. What will slow them down and take them out to that longer period of time is if he was a dystocia, if he was born during extreme weather conditions, either very hot or very cold, that's going to give him a little bit of a slower start. And so while we should give him the benefit of the doubt to some extent with those kind of extenuating circumstances, we still need to be out there keeping an eye on him. Of course, we want him to nurse colostrum. Ideally, we'd have him get that 5% within the 12 hours and then 10 within the 24 hours. But if you look at any charts that talk about the gut absorption of colostrum, most of them, have this start out here at the peak at the time of birth, and boy, they get out here at about 6 to 8 hours and they start to really fall off at that time. And so if I can feel pretty comfortable that they've gotten that 10% into them by 12 hours, I'm going to be feeling much better than if it's taken us the full 24 hours to get it in. Now, of course, if they're on the dam, we can't really quantify what they're getting. And so as long as I'm seeing that cria nursing usually about every hour, you're going to see them up there. Make sure they're staying there, make sure they're not hunting around, make sure that they're actually getting good nursing activity there. I'm going to feel pretty good that they've been able to get good passive transfer of colostral antibodies at that time. If I'm feeding them for some reason, the dam has agalactia, which is fairly common in this species. It's kind of interesting when I think of camelid failure passive transfer relative to cattle failure passive transfer. In cattle, to me, failure passive transfer in calves is almost always the calf's fault. Be it that he was born in the cold, he was weak, didn't get up and nurse. But when I see failure passive transfer in a camelid, a lot of times it is going to be due to dam agalactia. That's much more common in camelids than it is in cattle, and so we need to go deal with that dam when we're trying to deal with that cria that may be failure passive transfer. So routine procedures in day one. We're going to check on birth weight. I tend to be pretty hands-off that first 24 hours. We have this new teaching herd that was established here, and so we've had 3 females have their cria so far this year, and we've got some more coming. And the students hear from the caretakers that there's a new cria, and the first thing they want to do is we all want to run up the hill and kiss it. And so I have found the compromise of we will get in the truck and we will drive up and we will make sure that it is alive. And then we are going to drive back down to the school. I tend to be very hands-off with new neonates. Now, because of the importance, and we have these very defined boundaries for birth weight in llamas and alpacas, I do like to go ahead and get a birth weight on them. I'm happy to let that birth weight be a few hours down the road I kind of want him to get to know mom, especially if it's a maiden female. And so we'll kind of go up, make sure he's doing okay. We may go up a little later on, take a scale with us to him, not take him and his mom to the scale, get him weighed, make sure everything's doing okay, kind of give him just a quick once over, and then back in they go. That's a tough thing to get owners past. They want to go and get everything, make sure everything's okay. If that thing's looking good through the windshield, I'm probably going to keep my hands off of him for a little while. The weights I have up there, I tend to use about 14 pounds for alpaca crias, being what I consider to be bare bones minimum, about 17 pounds for a llama cria. This year, I've talked to a number of breeders that have had 23, 24, 25 pound alpaca crias. And so when I say that 14 and 17 pounds are bare bones minimum, that's what I mean. They really shouldn't be down 14 pounds. I really would be much happier to see 16, 17, 18 pound alpaca cria. I always like to do a good exam on the dam. It's, your intuition is to go right to that cria. But I want to get a good, at least a visual look at her mammary gland. I may see if she'll let me touch it, make sure that I don't have any evidence of mastitis there, and make sure that she in fact has an udder because of how common agalactia is in these girls. A health check, if I do go ahead and do an exam on him, get a quick TPR on him. I have the normal parameters listed there. These crias are going to be a little bit warmer than the dam. Don't be panicked if they're up at 101, 102. If everything else is looking okay, they're going to be a little warm that first day or so. That milk there, if you have the option, if you have the opportunity and you have some concerns about the mammary gland, and you go ahead and milk them out, and I apologize in this slide, you probably can't see that very well, but trust me that looks like about 2% cow's milk from the store. And so we had a teaching herd female this year, and we were wanting to see if the cow colostrum tests would work on alpaca colostrum to kind of give us an idea of the quality. And it doesn't, first of all. It said there were no immunoglobulins in there at all. And then you look at this stuff visually and you think, man, that looks like cow's milk. It doesn't even look like colostrum. This thing is going to be failure passive transfer. So the next day we go in and test the cria, and sure enough, he's got all the IgG in the world. And so don't let the visual appearance of that first milk make your decision about whether or not he's going to be failure passive transfer. We obviously need to still monitor for that, but it will look like skim milk sometimes and still be good colostrum. And so I know Dr. Anderson and I have had conversations about that, and he said he would have cria sent in to him for a plasma transfusion just based on how the colostrum looked. People look at it and say, and myself as well, I looked at this milk and thought, man, we're in huge trouble. He did fine. So don't let that visual exam fool you like it can do like you might in cows. I do like to give them a quick congenital defect check because of the high rate of congenital defects in these guys. Get a quick look at that hard palate and make sure we don't have a cleft palate, so that when he gets to going on his nursing, we're not going to have any issues there. Umbilical hernias, those kinds of things. But those types of things, listening to the heart, if he's doing pretty well otherwise, I may put those off until I've given him some more time to bond with mom and get some colostrum in him. A maturity check, you can, while you're looking at that palate, take a quick peek in there and make sure that his incisors are erupted. And then dipping navels is always a big controversial topic. Not only do you do it or not, but then what do you use when you do it? I'm not a big navel dipper. Maybe I should be more than I am, but if they're in a fairly clean area and that cria is good and strong, I'm not going to probably get too crazy about dipping that navel. I certainly don't want to dip it with anything that's very irritating or very strong. I do want to use a dilute version of whatever I'm doing. So if you're an iodine sort of person, just make sure that it's a dilute iodine. Chlorhexidine has been shown to be as effective, maybe even in some studies more effective than iodines, but you want to make sure it's a dilute one. What you don't want to do is cause a chemical irritation of that umbilicus that keeps it open or more susceptible to bacterial invasion during that time. This species does seem to be more susceptible to hemorrhage from the umbilicus than other species, and so occasionally you may be called in to try to ligate off an umbilical cord in them. You don't want to leave it on there very long. Leave it on there long enough for them to make a clot and then cut it back off. You want to get that ligature off of there, and then make sure that you make that ligation. Maybe if you've got enough cord to kind of make it away from the body wall, you'll be a little better off there. What we don't want to have happen is have some necrosis around your ligature, and then that set us up for either infection or an umbilical hernia due to the ligature. Again, you are at the mercy of where that cord decided to break, understandably. But if you have the option, don't tie him up there real tight. Move it out a little bit if you've got enough cord to do that with. Day 2, this is when we've gotten to day 2 and we still have a good strong looking cria. I'm going to be more than happy to really get a good exam on him at this time. Dan Linden talked to you this morning about weight gains. This is very important. I really like to follow these guys and see how they're doing. We want them to gain about 1/4 to 1/2 pound a day in alpacas, about double that in llamas. And I think Dr. Van Meter asked this morning about, do they lose weight initially like human babies do? Yes. Part of that is the drying process. If you run out there and you weigh him when he's soaking wet, first of all, he's going to lose some of that weight to drying even by later on that day, obviously. But then also there's that metabolic shift there, and they're going to lose some weight in those first couple days. So I don't get too worked up if I'm seeing that I have a bright alert cria and he's up nursing as often as I would like for him to. That first couple of weighings at 24 hours, maybe even out to 48 hours, I'm not going to panic too much if he's at his birth weight or even just a smudge less. It's ideally you'd like to weigh them daily out to 2 to 3 weeks. I find with the teaching herd, I'm often busy enough with other things when the new crias come along. I get them weighed, out to about day 5 or 6, and then I get back up there and have time to weigh them again in about a week or 10 days. And the next time I'm up there, I weigh him again and make sure that we're going in the right direction. So I don't necessarily get panicked about doing it every day. I think for breeders, that probably is a useful thing to encourage them to do. But if they're on a large farm and maybe don't have enough labor, once you get out to maybe that 5 or 6 days and things are looking pretty good, you can probably back off of that recommendation. It's kind of one of those things where you tell owners, I want you to do it this often, in hopes that they will do it, that they're likely to kind of back off with that a little bit. Now there's something that you might find interesting on this slide is to vaccinate these neonates for CD&T. This again is probably a personal preference kind of thing, but we are finding now more that neonates are very able to respond to vaccination, and this is coming out in the calf literature in particular, where we're finding that maybe maternal antibody interference is not as big a deal when it comes to with regards to the virals, and that these guys are immunocompetent, and that they may not be getting as much specific immunity from the colostrum as they can, particularly to the clostridials, and so we are actually starting to vaccinate these crias now at about day 2. And my main goal is usually just to get them done around day 2 or 3. Depends on how the cria is doing. If he's having kind of a rough start, I'm not going to jump in and vaccinate him. I'm going to wait until he's strong enough so I feel like he can respond to it. So if at day 2 or 3 he's coming along but he's just not a really strong, good cria, I'll wait till he's out to about a week and that I think he's doing much better now and can really respond to that vaccination. And then we'll go ahead and booster that then about 2 weeks after that initial vaccine. I'm giving him the full dose. And I'm glad that you asked that. She asked, what volume are you giving? Should you back off of that volume for a neonate? And I do not. In my mind, vaccination is vaccination. It's a titrated dose for what the immune system needs. And I don't really view the immune system as being sort of different sized, whether you're little or whether you're big. And so I do give the full dose for that clostridial vaccine. I tend to stay away from 7 and 8 ways. I tend to go with just a CD&T. Partially because the more ways you get in there, the more reactive the vaccine tends to become. You start to get into those black leg 7 and 8 ways, they're going to get pretty reactive. The CDTs tend to be much less so. And so I give to llamas and alpacas, I give them whatever the sheep dose is on the label. And so that in most vaccines is going to be a 2 ml dose under the skin. At this time then, I'm going to go ahead and bleed these crias for BBD PCR testing. If the herd is concerned about BBD and has that as part of their screening program, now's the time to find out if he's one of these persistently infected crias. Test him now. If he comes back negative, life is good. If he comes back positive, I would quarantine he and his dam, test the dam as well and find out if she could be a possible carrier, then retest at 4 to 6 weeks. And that's where we currently have persistent infection defined in camelids, is that you're virus positive on PCR for greater than 4 weeks. Then at that time, the alpaca industry has been very good about euthanizing those crias when they turn out to be persistently infected. At this time, now that we're past our 24 hours, we can go ahead and do our IgG testing. Serum total protein, we will often do that just as a quick test to give us an idea. And in some herds, that may be perfectly acceptable just to kind of do serum testing as a serum total proteins as a screening test. IgG is also can be measured directly, most commonly by the radial immunodiffusion plate. Problems with it are it certainly does cost a little more than the serum total protein, which tends to not be a big concern here. It also takes 24 hours to know about it, to get those results back for the plate to run. And so the serum total protein, you can run that at 24 hours of age and have a really good idea of how your IgG is going to come back while you're waiting on that test to go through. More and more now we're seeing that insurance companies are requiring us to report IgG levels on animals to be insured. And so when insurance is going to be a player in this animal's life, they're going to want an actual quantity. They're going to want a quantity of IgG. A serum total protein isn't going to cut it. And so they want milligrams per deciliter of IgG. And to do that, you're going to have to do the RID plate. So once we get them through those first couple of days, then we set them on cruise control and let them go. Continuing to weigh them during that time and monitoring for active nursing and making sure that the dam isn't kicking them off, or that she's not having issues with mastitis where she's not letting him nurse, or that she doesn't have milk to let him nurse. In selenium deficient areas, if you're in a land area where you know you've got selenium deficiency, you can dose those crias with Bosi. We don't give it to them when they're less than 7 days of age. We go ahead and wait that period of time and then give it to them. Another issue is rickets. Low vitamin D tends to be the biggest problem in dark colored fall and winter born crias. Mostly this is seen in the upper northwest, Oregon and Washington, where they have, I think, 2 days where the sun actually shines up there a year. These dark crias are born and they just don't absorb enough sunlight to make enough active vitamin D. But occasionally you will have some problems with this. This is a differential for crias with angular limb deformities. And so keep this in mind. I've got the dose in there for you as well. One of the biggest issues we get into is farms that are really paranoid about rickets, whether or not they have a basis to be concerned about rickets, will go in there and dose and redose with vitamin D. And it's common enough for us to see vitamin D toxicity. And so vitamin D, fat-soluble vitamin, it stays in them, they store it, and they hang on to it for a long time after it's been injected. So don't ever give it more often than every 60 days in these guys. And we have the ones we've seen are where owners are dosing them weekly or every couple of weeks with vitamin D. They just don't need it, and you're much more likely to make them toxic than you are. This part of the country, we just don't see it enough to be dosing animals that aggressively. So when we're doing these exams, what kind of parameters are we going to use to decide if this cria is doing okay or if it's considered to be high risk? We talked about low birth weight, and like I said, those are bare bones minimum birth weights. If they're down even close to that, I'm going to be concerned. Premature or dysmature, if they're less than 325 days of gestation. Any animal that was born as a result of a dystocia or C-section, or any time there was just an unobserved delivery where we just don't know how long it took. He could have been a very mild dystocia that she was able to deliver on her own. That cria still should be watched like he was a dystocia. I will say something about prematurity and the opposite end, which is over maturity, I guess. We get presented fairly commonly with overdue dams. And people want us to induce them and get him out of there. There must be something wrong. And in my mind, there are only two things that can make you be overdue. One is that you're a dystocia and we haven't figured it out yet, and you're just sitting in there with a dead fetus in you. We just don't see very often in these species like we'll sometimes do in cattle. The other one is if the fetus doesn't have an intact hypothalamic pituitary adrenal axis and therefore can't signal with cortisol that I'm ready to be born. I have never even heard of that in any species. And so we get these owners who come in and they say, she's overdue, I want him out of there. And we call induction of parturition in this species, as crude as it sounds, that is cria euthanasia. We do not have good luck with induction. We estimate that we probably have easily 4 times the number of complications and almost always results in a dead cria. He will come out when he's ready to come out. And so when you're presented with those overdue females, if you've got an ultrasound available, we'll get a heart rate on him, make sure the heart rate is staying up where it should, up above 80. Make sure that he's alive, that he's hasn't been trying to come out for a little while and isn't getting to come out. Do a vaginal or rectal exam, make sure everything's doing okay, and then she just needs to sit and cook for a little while. That's a real big paranoia that we see, and frequently ends in disaster when we intervene too aggressively with them. First-time moms, of course, it's just like a first-time dam of every other species. May not have as good a quality colostrum. She's not used to being a mom, doesn't know what she's supposed to do with this thing. Agalactia, talked about that as a big problem in this species. Environmental extremes. We don't like having crias born in the summer. This was one of our teaching herd crias. Because it's a teaching herd, we are trying to have crias throughout the year so that students are always being exposed to young crias. But this little guy sat like that for about the first 18 hours of his life. It was 100 degrees and it's just rough on him. And so we want to keep a good eye on those crias that are born either when it's really cold, really wet, or really hot. And then anytime there's malnutrition of the dam, that cria is probably going to come out weak, and then he's not going to get to make up for it because she is unlikely to be making good milk to raise him. Want to look at look at the umbilicus and all the common sites of sepsis, evidence of hypopyon in the eyes, septic arthritis. We just want to give him a good overall look. Check for pneumonia, those kinds of things. And I always like to do a good exam on the dam, physical exam. Check her body condition score, have a feel of her, and make sure that she has a body condition score that supports lactation. And then, of course, I talked about the agalactia. You can give them domperidone like you do in mares. 5 mils orally every 12 hours for 5 to 10 days. But I will warn you that you will often not see them start to make milk when this is successful until about that 7 to 10 day mark, and then that's usually when they get going. So during that time, when you start the domperidone and when she actually starts to make milk, we're going to have to do other provisions for that cria to buy him some time until his mom gets going. Just like any other neonate, there are lots of other things we can do when we start to find abnormal physical exam findings. We want to go ahead and pursue getting those diagnosed. Colostrum, if we test him before he's 24 hours old, we can go ahead and put some more colostrum in him and hope that the gut is still open. Remember that once they take something in orally, no matter what it is, gut closure really starts to rapidly begin at that point in time. And so if he got a dose of colostrum or of electrolytes or of milk or whatever, and we come in at 18 hours, he's much more likely to have already shut down pretty significantly by that time because he's already received something else orally. Plasma transfusions, again, another time I'm going to kind of stick my neck out. I do not give IP plasma, intraperitoneal plasma. I like to give it IV. They can get pretty colicky after they get plasma in the peritoneal cavity, and unless you are absolutely sterile, you've just made his peritoneum into a blood auger plate. And if you weren't absolutely clean, if you're trying to do this on the farm, the risk of peritonitis there is certainly increased by having plasma in that peritoneum. So I tend to try to avoid IP if at all possible. It certainly is fast and it certainly is handy. I will say that about IP. Congenital diseases, as I said, pretty common among camelids. The Spanish invaded South America, killed off all the camelids, and then we had this very narrow gene pool. They get to come to North America, and then there was kind of this very shallow gene pool to work with. We commonly see them in the musculoskeletal system, reproductive tract, and facial abnormalities. Only 3 congenital defects in these species are known to be heritable, have been gone through all the testing to know this in fact is heritable. Wry tail is one, choanal atresia, and the tipped ears. And so if you think about, boy, there are a lot of congenital defects that we see in these guys that aren't on this list. Again, these have gone through full testing to show that they are heritable. I still do, though, with most of the others, say heritability is likely in so many of them. And so don't let this list hold you back, you know, when you feel strongly and you've seen something consistently over time. Wry face or maxillofacial dysgenesis is a kind of a scissoring of the maxilla over the mandible. You can see this cria, you're looking at him straight on, that nose is kind of kinked off to the left there. This is one of the most severe cases I've ever seen in a llama, where he's completely scissored his mandible over his maxilla, and he now sort of uses his mandible like a shovel. There certainly are concerns for heritability in this one, and wry face animals should not be rebred. Choanal we do know that that's heritable. When you have a cria that presents to you open mouth breathing, brand new cria, shows up open mouth breathing, it's a choanal atresia until proven otherwise. We have been burned on it a couple of times here. We'll have an open mouth cria come in, we think we're getting a choanal atresia, and it'll be a septic cria that has a pneumonia or something like that. But you've got to, don't just assume that it's a dyspnea from a respiratory infection or a pneumonia. Make sure that you can get choanal atresia ruled out there. You can do that pretty easily with just passing a small red rubber catheter, one of the stiffer type, and see if you can pass it through the ventral meatus and get it past the nasal passages. If you can't do that, pretty suspicious. You can also tilt their head up and just drop some barium down in their nose and get a lateral plain film radiograph then, and see if the barium dripped back into the throat or not. Did it get trapped in the nasal cavity? So you can kind of screen them based on that. Nasolacrimal duct atresia, we're seeing this a fair amount where these animals have messy eyes for long periods of time. They're on ophthalmic antibiotics and they're just not clearing up, and they either have a blocked nasolacrimal duct, which is very common, or when these animals present and they're about 6 to 8 months old, I'm very suspicious that that animal doesn't have a nasolacrimal duct. And so we have techniques then where we can go in and open that up. One of the real common versions of that is where they just don't have the nasal opening. So they'll have the upper openings, and then you pass a catheter down and you hit a blind sac, and you can usually just slit that with a needle or with a scalpel blade and be able to get a catheter passed through that. And then I just leave the catheter in, kind of suture it out to their face, leave that in for that hole to heal open, and then you've made them a patent duct. Occasionally we will have to tunnel through bone and actually create a duct. Fortunately, we don't have to do that very often. Angular limb deformity is probably one of the most common ones that we see. If you ask me, every cria looks crooked to me from the front end. They all are varying degrees of crookedness. And so I like to monitor those and see if it worsens or does it stay about the same. We usually make a decision about what to do with angular limb deformities when they're about 3 to 4 months old. We usually don't pounce right on that right away. Lots of other choices there that aren't quite as common. Angular limb deformity, a little more about it. Certainly when they're premature, they don't have those mature carpal bones. They've got softer bones, an issue there. The vitamin D can be an issue there. Other macro and trace minerals, copper, can play into that. And so what I do is when they're born crooked like that, we monitor them over time and see how they do. This particular cria was born moderately crooked, and as we continued to watch him as he grew, as he gained weight, he became more crooked. And so, as I said, we'll often not make a surgical decision until they're about 3 or 4 months of age. But if they are getting worse, then we're going to intervene on that cria earlier than waiting out to that time. If they're static and doing pretty well otherwise, we're probably not going to jump on them surgically at that time. At that time, based on their age when they present and based on their degree of angulation, that's how we're going to choose how aggressive, which surgical procedure we're going to use and how aggressive we're going to get. This particular cria here, I think he was about 3 or 4 weeks of age when we did him. Pretty moderate to severe angular limb deformity when we did surgery on him. We did periosteal stripping on him. Because he's young, he's still got a lot of growing left in him. He's got a lot of time to straighten those legs back out by growing that bone more straight. Reproductive tract, the big thing here is that when you sell an unproven female, a maiden female, it's a really good idea to have a reproductive exam as part of her pre-breeding. They're on the inside, we can't see them from the outside, and it's something that we need to evaluate. And a lot of these females will be sold with a guarantee to breed, so we want to make sure that they're able to breed. One of the things that we have noticed is the phenotype for a female to be very tall and lanky is usually a clue that she's got an ovarian hypoplasia. And so if we're presented with a female who's a non-breeder and you look at her and her back is 8 inches above everybody else's back in the herd, and she's kind of got that long, lanky phenotype, make sure you get an ultrasound of her ovaries, because there's a good chance that they're tiny or not there. Umbilical hernia, another one. What I like to do on these, most of them are small. It's rare to see a really huge hernia in these guys. So I put a belly wrap on them. I usually use Elasticon, which is a lot of fun to take off, but it does a really good job of staying where you put it. So it's kind of a pain. I'll take a 4x4 gauze and fold it up so it's pretty thick, put that right over the defect, and then wrap them up with Elasticon and let them go. I leave that on for 2 weeks, take it back off and see how we're doing. If it's shrinking down, I may go another 2 weeks, and I just sort of keep going till it's gone. When I get out and we've either reached a plateau or it's not shrinking at all, then I'm going to go in and surgically repair those. If it's huge to start with, you can certainly try the belly wrapping, but you're probably going to end up at surgery at some point on that guy. But you may wait till he's a little bit older and is a better anesthetic and surgical candidate. We talked about how dystocias certainly, and it just makes sense. This is common sense, but certainly 4 times more likely to have issues, and so we really need to watch those extra closely. Make sure that you're encouraging owners that when they have a dystocia, if the owner is able to get it resolved or the female resolves it on her own, encourage them to have that animal examined by a veterinarian to make sure that things are going okay, either that first or second day. And then season of birth, I think Dr. Anderson alluded to this earlier. Fall-born crias and even summer-born crias are going to be more likely to have some health issues, and so the spring-borns tend to be the healthiest as a group.